94.1 WHRP. It is Wellness Wednesday. Tony in the morning and DJ Primetime 256. And our special lady who gives us all the great medical tips. It is Dr. Whitney West, MD, PC. How are you, Dr. West?
I'm doing great.
We always like it to hear when our doctors are doing great. That gives us hope. So today we're going to talk about something that is very concerning when you hear this possibly happening to you, the polycystic ovarian syndrome, and definitely something that a lot of people don't hear about or talk about.
Dr. Whitney West, what exactly is polycystic ovarian syndrome?
So the name would imply that there's something physically wrong with the ovary. Polycystic just means many cysts on the ovary. But what it really is a hormonal imbalance, and it causes many symptoms that patients have that come in with. They don't realize that's what they have until they've had a workup and then subsequent management.
So, what are some of the symptoms? What would make somebody feel or think that there was something wrong?
Well, the first one is a typical patient has irregular bleeding.
Mm,
Irregular periods.
mm.
They don't come as often. They have them a couple times a year, and then the other things that come along with that include acne, obesity, and then problems with what happens when you don't have a regular period, which excuse me, which means infertility. So long term unchecked PCOS will cause infertility because your ovaries are not functioning properly and hormonally. So you're not going to be able to get pregnant, and that'll be sometimes one of the reasons why they come in. The periods are irregular, and then they cannot get pregnant, and then they want to find out what's going on.
Dr. Whitney West, Wellness Wednesday. We're talking about polycystic ovarian syndrome and what is the best way to manage through it all?
Well, the biggest deal would be making sure you get the correct diagnoses because that's what doesn't happen. Either patients don't come in, or when they do come in, they're not given the workup that they require because one part of this hormonal imbalance also includes what we call insulin resistance. And insulin resistance is like a step away from prediabetes. So it's how your body processes your food and breaks down. Insulin resistance basically means that the insulin that your body is making, which is used to break down the food that you're taking in, is not functioning properly. So we're not able to get the sugar into the cells for it to function properly, and then we have things like this more insulin that's required to do the same job, and then we have issues with gaining weight, and then triglyceride, like your cholesterol and triglycerides go up, and that kind of thing. We have what's called metabolic syndrome. It turns into a whole body kind of issue. So it's not just my periods are irregular. It is I have a hormonal imbalance, and insulin is a hormone.
Hmm. Okay. Dr. Whitney West, Wellness Wednesday, something that you don't often hear people talk about, and we're glad you brought it to the forefront, polycystic ovarian syndrome. Now, when I first started talking about this with some friends, the first thing, whenever you hear ovarian, you hear the word cancer follow behind this. Does this have anything to do with that?
No, this is not related to that at all. So PCOS, and we'll call it for short, PCOS is more related to metabolic issues. So cardiovascular, diabetes, we're talking about those kinds of things long term, in addition to the infertility, which eventually could lead to cancer at some point. But having PCOS does not put you at increased risk for ovarian cancer. You asked me just a few minutes ago about management. So management will depend on what your workup entails. I don't usually require that an ultrasound be done to look at the ovaries to see if there are many cysts there, because you can get the diagnoses with lab work and in a history, like when you talk to the patient, what their clinical symptoms are, and then what their lab work shows. And then you manage them based on all of that information. Typically, what we'll do is something that will help your female hormones get back in order, and then we help the insulin resistance piece. So sometimes we use medications that people are familiar with that are used in diabetes. So like metformin, but there are natural remedies that we can use like berberine and chromium that'll help with, that'll actually have the same function that metformin does without the side effects. But it's important to be seen. So if your menstrual cycles are not regular, you are overweight, you have acne, and darkening of your neck, and up, back of your neck and stuff like that, then you need to be evaluated. First, we'd have to rule out diabetes, and then we'd proceed with, the rest of the workup, and then how we manage you based on that.
I do have one more question in regards to this. And you mentioned the ovarian having cyst. Do you remove the cyst?
No, because on ultrasound they have the appearance of like little pearls. So one of the terms that we use when we're talking about somebody who has PCOS and what their ovary would look like, we call it a string of pearls. So it's just really small, and a cyst is just a fluid-filled sac. So your ovary is working, trying to find that egg that's going to be released, and then you got what we call follicles, and that's what those little cysts are. So it's not necessary to remove them. Having an ovarian cyst is different from having PCOS. So if you have a condition that where they say, oh, you have a cyst on your ovary, you can have discomfort and pain, but it's not going to be associated necessarily with irregular bleeding and obesity and insulin resistance. This is just a cyst on your ovary. And then depending on how big it is, may require removal.
Okay. All right. Well, there's someone that's listening and paying attention to us in regards to this polycystic ovarian syndrome. And I'm sure they're going to want to contact you and get more information. What's the best way to do that?
My website is wsmdpc.com.
And your parting words?
Empower Wellness. It is a journey, not a destination.